Hello, you've had a skin assessment and they recommend a great treatment. It works wonders for your skin for a few days. But then, whoa, something happened. Well, your skin kind of changes. Actually, it's not your skin that changes, its needs evolve constantly. Your skin itself doesn't really change, but sometimes it needs more salts to lock in moisture, and other times it needs more oils or and fats to protect itself. And these changes happen constantly. If you're trying to understand your skin and give it the care it really needs, but what works for it and for you one day doesn't seem to work the next, I'm here to explain how your hormones are playing a role in this and how to adjust accordingly. I'm Mireille Vega, Dr. Mimi, biochemist and founder of Vegan Biome and the One Human Skin philosophy. And protect, restore, adapt. I've spent years studying the connections between our lifestyle, the products we use, and our skin to help simplify my own daily routine and yours too. Our hormones, skin, brain, diet, mindset, and habits, they're all connected. Today, I want to share with you the simplified knowledge I've gathered so you can make safer, smarter choices for your skin and your health. So let's talk about your hormones. They influence everything your mood, of course, but also your skin and your metabolism. So let's start with reproductive hormones. For women, there are four main hormones to consider, but we'll really focus on one. But let me go through the four of them. So you have testosterone, which is part of the cycle. It's attributed mostly to men, but women do have it too, and its levels vary during the month. Oxytocin, which is more of the mood hormone, and then you have progesterone and estrogen. So these are the two key ones. But for the skin, you'll see the variations of estrogen really influence how your skin feels and look. So the first phase, menstrual phase, lasting about the first 5 days of the month, our hormonals level are low everywhere, the four of them anyway. So your skin may be dry, dull, more sensitive. Breakouts may occur, mainly because of the whole declining hormone levels that occurred prior to menstruation. So this is what I call the drier phase because everything is relative. One person dry is actually almost oily for another. So the drier phase, the first 5 days about of the month. And then we go into the follicular phase, where you have increasing levels of estrogen. Progesterone remains low, oxytocin's rising, and testosterone's increasing as well. So this phase lasts about a week. The skin appears brighter and more hydrated. Its collagen production increase as well. There's fewer breakout. This is what I call the normal kind of phase before the ovulatory phase, which lasts just a few days, 2 3 days. Is a peak of estrogen. The progesterone is still low. It will rise later on. Oxytocin is high, and testosterone for women at its peak. And men, this is also where you spend some time, like during your month. We'll get to that. This is the time where the skin is usually at its best. It's glowy, it's hydrated, it's firm, the pores may appear even smaller. It's an illusion, but still, like you are glowy, you love your skin at that time. Some women may experience breakout due to a spike in testosterone, but because it's so glowy, the skin, you don't even mind it. Finally, you have the luteal phase, which is the declining estrogen phase. So at the beginning is still fine. At the end, evidently, you have very low levels, but you have increasing progesterone levels. The oxytocin is stable, and this testosterone is also declining. So evidently for men, the beginning of this phase is also where you hang out. So your skin may appear oilier, leading to breakouts, especially around the jaw lines. There's an increased redness and sensitivity, especially towards the end, possible puffiness and dullness as progesterone increases. So this is the oilier phase. So for men, you're in the glow oilier phase most of the time. And I'm saying most of the time because there's also another hormone that influences you and women as well. Don't forget about cortisol. So, cortisol is the stress hormone. And what is it doing? It actually influences all of your reproductive hormones to be decreased. So, this fabulous glow that comes about with testosterone and estrogen is actually going down. So, this means that your skin will be constantly changing. Sure, there's other factors like diet, exercise, external elements. But when you add it all together, it's really clear your skin needs are not only changing 4 times a month, they're changing daily, depending on your stress level and your amount of sleep. Because remember, low sleep causes stress and cortisol hormone to increase. So sometimes you need more salts or more oils or less oils. You need to be able to adapt. So to do that, you need to be conscious of these shifts and to listen to your skin, and that's it. So do you feel it oilier or drier? And then you can adapt depending on what it needs. And it's normal for your care to change on an almost daily basis. So, in summary, your skin goes through 4 shifts during the month, but hormone levels change all the time. So, it's never the same from day to day. You have to learn to listen to your skin and adapt. Stress and lack of sleep lower reproductive hormones, which not only harm your general health, but also your skin. Now, you know why and you know what to do to adjust. If you found this video helpful and want to learn more about the ingredients to look for and how to care for your skin in a healthy way, don't forget to subscribe to my channel. Feel free also to drop any questions in the comments. And if you want more information on harmful ingredients for your skin, yes, there are a few, be sure to download my free guide on no ingredients. You can also take an assessment to better understand your unique skin's proportions and needs and to adapt accordingly.